Welcome to the deep dive. Today, we're diving into something that you might not even know about. It's called hyperprolactinemia. You sent us a bunch of medical excerpts on this, and we're going to help break it down for you. It sounds a little intimidating, but we're going to make it clear, easy to remember, and maybe even, have a little fun along the way.
Yeah, that's a great goal. And actually, a lot of this stuff is pretty fascinating. We're talking about elevated levels of prolactin, a hormone that most people just think about milk production.
Right.
But it does so much more than that.
Oh,
It impacts your reproductive system, your bone health, and it can even cause some unexpected symptoms if it gets out of balance.
So why should you even care about prolactin?
Right.
Well, if your levels are too high, it can lead to all sorts of things like headaches, vision problems, even infertility. And the excerpts you send over mention that most cases are actually caused by this tiny little tumor in your pituitary gland. It's called a prolactinoma.
Yeah, and that's where things get really interesting. These prolactinomas are like the Goldilocks of tumors. Size really matters. Microadenoma are less than a centimeter. And usually they don't even cause any problems. Most of them don't even grow over time.
Wow.
Then there are macroadenomas, which are a centimeter or bigger, and can sometimes press on those surrounding structures, which leads to those headaches and vision issues we talked about.
Okay, so we've got these tiny tumors that are causing big hormone problems.
Right.
What's the solution? You sent over some research on dopamine agonists. What exactly are those?
So dopamine agonists are the first-line treatment for prolactinomas.
Okay.
And they work kind of like a brake on prolactin production. They bind to dopamine receptors in your pituitary gland and basically tell those overactive cells to just chill out.
That's a pretty cool way to put it. So the excerpts specifically mention bromocriptine and cabergoline.
Yeah.
Are those the most common dopamine agonists?
Yes, those are the usual suspects.
Right.
And while both can be effective, cabergoline has a slight edge. It seems to work a bit better, it has fewer side effects, and it's only taken once or twice a week.
Wow.
And you can compare that to bromocriptine, which has to be taken twice a day.
Oh, wow. Okay.
And cabergoline is also less likely to upset your stomach.
Yeah, that's definitely a plus. So fewer side effects and more convenient dosing.
Sounds like cabergoline wins that round.
It does.
But, we have to address the elephant in the room. Every medication has side effects, right?
Of course. And dopamine agonists are no conception. But the good news is most of those side effects are mild and pretty manageable. We're talking things like nausea, dizziness, stuffy nose, and there are even ways to kind of minimize those. Starting with a low dose and taking it at bedtime or with food can really help. And women can even take cabergoline vaginally to avoid nausea.
Okay, that's definitely not something I expected to learn today.
It's interesting.
But speaking of side effects, the excerpts you sent mentioned valvular heart disease as a more serious potential problem.
Yeah.
That has to be a bit concerning, right?
Oh.
Yeah, it's definitely a valid concern. But it's important to put it into perspective. Valvular heart disease has been linked to dopamine agonists.
Yeah.
But mostly at much higher doses and Right. with long-term use like we see in Parkinson's disease. At the doses typically used for prolactinomas, the risk is much, much lower.
Okay.
But monitoring is still important, especially at those higher doses, just to be on the safe side.
That makes sense. So it's all about weighing the benefits against the risks.
Exactly.
And speaking of benefits, the excerpts highlighted something pretty incredible. Dopamine agonists can actually shrink the tumor itself.
Yeah.
Even in macroadenomas. I was pretty shocked by that. How does that even work?
It is remarkable, isn't it?
Yeah.
Dopamine agonists not only lower those prolactin levels, but they can also reduce the size of the tumor itself,
Wow.
often dramatically.
Really?
Yeah, and we can actually see this in action. One of your excerpts includes this image showing the shrinkage of a macroadenoma
Okay.
over time with dopamine agonist treatment. It's really neat. It highlights how powerful these medications can be.
That's amazing. So to recap, we've got these tumors that are causing these prolactin levels to go haywire.
Right.
And then we have dopamine agonists swooping in to lower the prolactin and often shrinking the tumor in the process.
Yep.
But how did doctors decide on the best treatment for each person? The excerpts mention that there's no one-size-fits-all approach.
Right. It really depends on a few factors. The size of the tumor, how bad the symptoms are, what the individual prefers, and even whether they're planning on having children.
Okay, so let's break it down, scenario by scenario. What happens if someone has a microadenoma that's causing, some annoying symptoms?
Okay, in that case, dopamine agonists are usually the first line of defense.
Okay.
They're really good at lowering those prolactin levels and easing those
All
symptoms.
right.
And also preventing the tumor from growing.
Gotcha.
So it's kind of a win-win.
Yeah, that makes sense. But what about someone with a macroadenoma, maybe one that's causing vision problems or other issues? Is it the same approach?
Dopamine agonists are still usually the go-to treatment for macroadenomas.
Hmm.
They've been shown to shrink even those large tumors
Wow.
and can significantly improve vision. But if the tumor is really big
Okay.
or it just doesn't respond well to the medication,
Okay.
then surgery might be considered.
Surgery, like to remove the tumor, that sounds pretty intense.
It sounds more intimidating than it actually is. It's a minimally invasive procedure called transsphenoidal surgery, where they actually go through your nose to reach the pituitary gland
Oh.
and remove the tumor. But like I said, it's usually reserved for those tougher cases where medication just isn't enough.
Wow. I had no idea they could do that through the nose.
It's pretty amazing.
That's fascinating and definitely something that we can maybe explore more in part 2 of our deep dive.
Absolutely. We'll delve into the details of transsphenoidal surgery and other treatment options for hyperprolactinemia in the next part.
But before we wrap up part 1, let's address one more burning question. Can you ever stop taking dopamine agonists once you start? I'm sure, a lot of people are curious about that.
That's an excellent question. And the answer is sometimes. It's definitely possible, but it's not always so straightforward. The research suggests that for some people, that hyperprolactinemia can come back,
Oh, really?
even after years of normal prolactin levels.
Oh, wow. So it's like a game of like hormonal whack-a-mole?
Kind of.
You think you've got it under control and then it pops back up. But are there ways to make stopping treatment more successful?
Yes, there are. And we'll definitely discuss that in detail in part 2 of our deep dive, along with a whole lot more, so stay tuned.
Welcome back to the deep dive. Before we move on, let's circle back to that question we left off with. Can you ever stop taking dopamine agonists after you've had successful treatment for hyperprolactinemia? Yes, let's pick up right where we left off. So, stopping medication is always like a welcome thought, but it sounds like it's not always a smooth ride. You mentioned that hyperprolactinemia can return even after years of normal prolactin levels.
That's right. It can be a bit tricky. But there are a few things that can increase your chances of successfully stopping the treatment.
Okay.
One is which dopamine agonist you've been taking.
Okay.
Studies have shown that people who take cabergoline, they're actually less likely to experience that prolactin surge after stopping compared to those who are on bromocriptine.
So another point for cabergoline.
Right.
Not only is it more effective and easier to take, but it also seems to have a better track record for keeping prolactin in check even after you stop taking it.
Exactly. Another important factor is how long you've been taking the medication.
Yeah.
The longer you're on treatment, the better your odds of staying in remission once you stop.
Yeah.
Ideally, you want to be on treatment for at least 2 years before even thinking about discontinuing.
So it's like you're training your pituitary gland to like behave itself over time.
Yeah.
Kind of like a puppy learning a new trick. But what about the size of the tumor? Does that matter too?
It absolutely does. If the tumor has shrunk significantly while you're on the meds, that's a really good sign. It means it's less likely to start pumping out excess prolactin again.
So you want to give that pituitary gland a good talking to with medication first.
Right.
Make sure the tumor is on its best behavior before you even think about stopping treatment. But even then, it sounds like it's important to stay vigilant.
You're exactly right. Monitoring is key.
Okay.
Even after you've successfully withdrawn from medication, you'll want to check your prolactin levels regularly just to be sure everything's still in balance. And if there's any sign of that prolactin resurgence, you might need to go back on the medication, at least for a little while, to get things back under control.
Okay. So dopamine agonists seem to be the go-to treatment for like most cases of hyperprolactinemia. But what about those situations where they just don't, cut it? What are the other options? The excerpts you sent mentioned surgery.
Yeah, there are a few other options. If dopamine agonists aren't working, or if the tumor is causing more serious problems like vision loss, then surgery might be necessary. It's called transsphenoidal surgery.
Okay.
And it's actually less invasive than it sounds.
Wait, remind me, you said it's done through the nose, right?
That's right. They go through the nasal passages to access the pituitary gland and remove the tumor. It's a minimally invasive technique, and the success rate is really high, especially for those smaller microadenomas.
Okay.
For the larger macroadenomas, it can be a little bit trickier to remove the whole tumor. So there's a slightly higher chance it could come back. But even in those cases, surgery can often significantly reduce prolactin levels
Okay.
and improve the symptoms.
Wow, that's incredible. It's amazing what they can do with surgery these days.
It really is. And in some cases, surgery might even be recommended before pregnancy,
Oh, wow.
especially for women with larger macroadenomas.
Mm.
Remember how we talked about pregnancy potentially causing those prolactinomas to grow?
Right.
Well, surgery can help to manage that risk
Okay.
and hopefully prevent complications for both mom and baby.
That makes a lot of sense. It's all about being proactive and minimizing that risk. Okay, so we've talked about medication and surgery. Are there any other treatment options for hyperprolactinemia?
There's one more option, although it's not used very often.
Okay.
Radiation therapy.
Radiation therapy. Isn't that typically used for cancer treatment?
Yes, it is. But in very rare cases, it might be considered for large prolactinomas that haven't responded to other treatments, or if they come back after surgery.
Okay, so it's kind of like a last resort,
Yeah,
only used in those like really extreme situations.
exactly. And it's important to note that radiation therapy can have side effects, like potential damage to the pituitary gland and those surrounding structures.
Got it. So it's a serious decision that should only be made after careful consideration,
Yeah.
weighing the benefits against the risks.
You've hit the nail on the head.
Yeah.
And it all circles back to what we talked about before, the importance of personalized care.
Yeah.
Your doctor can help you to navigate those decisions
Yeah.
and create a treatment plan that best fits your needs and your circumstances.
That makes sense. It's like having a trusted guide to help you navigate like this complex medical maze.
Exactly.
So let's say a woman has a microadenoma and she's having, irregular periods or difficulty getting pregnant because of it. Would she go straight to dopamine agonists?
In most cases, yes. A dopamine agonist would be the first-line treatment for a microadenoma that's causing those types of symptoms.
Okay.
They're very effective at lowering those prolactin levels and getting those menstrual cycles back on track, which can often restore fertility.
But what if a woman doesn't want to get pregnant right away
Okay.
and she can't tolerate dopamine agonists? Or maybe they aren't working for her. What are her options then?
In that case, estrogen therapy might be an option.
Right.
Estrogen, combined with a progestin, can help to regulate the menstrual cycle.
Okay.
And it also protects against bone loss, which can be a concern when those estrogen levels are low because of the hyperprolactinemia.
So it's like a way to manage those symptoms without necessarily addressing like the root cause of the hyperprolactinemia.
Precisely. But it's important to remember that estrogen therapy alone, that won't shrink the tumor.
Okay.
So regular monitoring is still needed to make sure that adenoma isn't growing.
That makes sense. It's kind of a temporary solution, not like a cure.
That's a good way to put it.
Yeah.
And it's worth noting that estrogen therapy wouldn't be appropriate for women with macroadenomas because estrogen can actually stimulate tumor growth in those cases.
Oh, okay. That's important to know. So far, we've been focusing on prolactinomas as like the main culprit behind hyperprolactinemia.
Right.
But your excerpts mentioned other potential causes too, right?
Absolutely. There are a few other things that can throw those prolactin levels out of whack. One of the most common is hypothyroidism, an underactive thyroid gland.
Oh, really? So a sluggish thyroid can actually lead to high prolactin. That's a connection I hadn't made before.
It's a bit indirect, but essentially when your thyroid hormone levels are low, your body tries to compensate by releasing more of a hormone called TRH, thyrotropin-releasing hormone.
Okay.
And it turns out that TRH can also stimulate prolactin production.
Wow, that's fascinating. So it's like this chain reaction.
Yeah.
One hormonal imbalance leads to another.
Exactly. But the good news is that when hypothyroidism is the root cause of hyperprolactinemia, treating that thyroid issue usually takes care of the prolactin problem too.
So if you fix the thyroid, you fix the prolactin.
In most cases, yes.
That's reassuring. No need for dopamine agonists or any other interventions in those cases?
Usually not. Another potential cause mentioned in your excerpts was certain medications, particularly antipsychotics.
Oh, okay. Antipsychotics. Those are medications used to treat mental health conditions, right?
Yes, they are. And they work by blocking dopamine receptors in the brain.
Okay.
And remember, dopamine plays a key role in regulating prolactin production.
Right.
So by blocking dopamine, these medications can unintentionally lead to hyperprolactinemia.
That's interesting. So it's like a side effect of how the medication works. What can be done in those situations?
Well, if the antipsychotic medication is absolutely necessary, there are a couple of options. One possibility is to add a dopamine agonist to kind of counteract those prolactin-raising effects of the antipsychotic.
Hmm.
But this approach needs careful monitoring because it could potentially interfere with how well that antipsychotic medication is working.
Right. It's like you're walking a tightrope.
Yeah.
You've got to find the right balance. What are the other options?
Another possibility is to switch to a different antipsychotic.
Hmm.
That is less likely to cause hyperprolactinemia.
Okay.
There are some newer antipsychotics available that have a better side effect profile in that regard.
So it's all about finding like the right medication that effectively manages the mental health condition while minimizing the impact on the prolactin levels.
Exactly.
That must require a lot of collaboration between doctors.
Absolutely. And of course, these decisions should always be made in consultation with a psychiatrist or another mental health professional who can properly assess the individual's needs and make those best medication choices.
That makes perfect sense. And finally, your excerpts mentioned that some hypothalamic and pituitary diseases can also lead to hyperprolactinemia.
That's right. These are conditions that directly affect the hypothalamus or the pituitary gland, which are essentially the control centers for prolactin production.
So in those cases, it's like the source of the problem is right at the root of that prolactin pathway.
Exactly. And treatment for these conditions depends on the specific diagnosis.
Okay.
In some cases, surgery or radiation therapy might be necessary to remove or shrink a tumor or other abnormality.
So it's definitely more complicated than just taking a dopamine agonist.
Yes, it requires a much more targeted approach where you're addressing that underlying condition rather than just managing those prolactin levels.
Well, we've covered a lot of ground so far.
We have.
We've explored all sorts of causes of hyperprolactinemia from prolactinomas and thyroid issues to medication side effects. And we've gone over all those different treatment options from medication and surgery to radiation therapy.
It's been quite a deep dive. And most importantly, we've really highlighted how crucial it is to have that individualized care and that open communication with your healthcare provider.
Couldn't agree more. So if you're out there listening and you're experiencing any of the symptoms that we've discussed, irregular periods, trouble getting pregnant, headaches, vision problems, or even unexpected milk production, don't hesitate to reach out to your doctor.
They can help you to figure out if hyperprolactinemia is the culprit and guide you towards that best course of action.
Now, in the final part of our deep dive, we're going to explore something that wasn't explicitly mentioned in your excerpts: the impact of lifestyle factors on prolactin levels.
Ooh, that's a really interesting area to explore. We'll delve into the potential roles of stress, sleep, exercise, and even diet in influencing prolactin production.
So stay tuned for part 3, where we uncover some surprising insights into the subtle ways our daily habits might be affecting our hormonal balance. Welcome back to the final part of our deep dive. We've covered so much ground already, from the complexities of prolactinomas to that surprising link between your thyroid and your prolactin levels.
It has been quite a journey, and now we're venturing into a really fascinating area that actually wasn't explicitly covered in the excerpts you sent: the impact of lifestyle factors on prolactin.
Okay, I'm intrigued. So we know that prolactinomas and other medical conditions can, kind of throw prolactin levels out of whack. But are you saying that our everyday habits can actually influence this hormone too?
Absolutely. There's growing evidence that things like stress, sleep, exercise, and even what you eat can subtly but significantly impact prolactin production.
Wow, that's amazing. I had no idea. So let's break it down. Where do we even begin with all these lifestyle factors?
Well, let's start with stress.
Yeah.
A universal experience, wouldn't you say?
I would agree with that.
When we're chronically stressed, our bodies release a cascade of hormones, including cortisol.
Okay.
Cortisol is really essential for helping us to cope with those stressful situations.
Mm-hmm.
But it can also mess with dopamine production.
Ah, dopamine. That takes us right back to our discussion about dopamine agonists. So if stress lowers dopamine, does that mean that prolactin levels go up?
You got it. Chronic stress can create this hormonal imbalance that favors prolactin production.
Yeah.
And here's where things get really interesting.
Okay.
Studies have shown that even short bursts of intense exercise can temporarily increase prolactin levels.
Hold on. Exercise is supposed to be good for us, right?
It is.
But you're saying that it can raise prolactin? That just seems counterintuitive.
It might seem a bit paradoxical, but remember, exercise, especially that really intense exercise, is a form of stress on the body.
Oh, okay.
It challenges our systems. It triggers that same hormonal response that we talked about.
Hmm.
But the good news is that this prolactin spike from exercise is usually very short-lived. Once your body kind of adapts to that exercise routine, those prolactin levels typically go back to normal.
Okay, that makes me feel better. So it's more of a temporary blip than a long-term concern. What about other types of exercise, like yoga or Pilates? Do those have the same effect on prolactin?
That's a great question, and one that researchers are still exploring. Some studies suggest that those gentler forms of exercise might actually help to lower prolactin levels
Hmm.
by reducing stress and promoting relaxation.
Right.
But we definitely need more research to say for sure.
Makes sense. So we've covered stress and exercise. What other lifestyle factors can impact prolactin?
Sleep is another crucial one.
Okay.
Studies have shown that prolactin levels, they naturally rise during sleep,
Mhm.
peaking in those early morning hours. And it's thought that this surge in prolactin actually plays a role in all of those restorative processes that are happening while we're sleeping.
So getting a good night's sleep is like a natural prolactin booster.
Kind of.
But what if you're not getting enough sleep? Does that throw things off balance?
You bet. Sleep deprivation can really disrupt that normal prolactin rhythm, leading to chronically elevated levels.
Hmm.
And that can have downstream effects on other hormones, including those involved in regulating things like your menstrual cycles and fertility.
Wow. I never realized how interconnected like everything is. It's like our bodies are these finely tuned instruments, and if one part gets out of tune, it kind of affects the whole orchestra.
That's a great analogy.
Yeah.
And speaking of fine-tuning, did you know that even our diets can play a role in prolactin regulation?
Oh, wow. Okay.
Certain nutrients like protein and specific amino acids, they're actually involved in dopamine production.
Okay.
So a diet that's lacking in those key nutrients, it could potentially lead to lower dopamine levels and, as a result, higher prolactin.
So you're telling me that like a balanced diet with plenty of protein could be like a secret weapon in managing hyperprolactinemia. I'm all about that. Pass the chicken, please.
Well, it's not quite that simple. It's not like a magic bullet.
Okay.
But diet is definitely an important piece of the puzzle. It's always worth paying attention to what we're eating and making sure we're getting the nutrients our bodies need for that optimal hormonal balance.
That makes sense. So we've covered stress, exercise, sleep, and diet. Any other lifestyle factors that can influence prolactin?
One more worth mentioning, herbal supplements. Some herbs, like chasteberry, have a really long history of use in regulating hormones.
Hmm.
And there's some evidence to suggest that they might be helpful in lowering prolactin levels.
Herbal remedy is always so interesting and a little mysterious. But I know it's important to remember that natural doesn't always mean safe.
Exactly.
Yeah.
You always want to talk to your doctor before you start any herbal supplements, especially if you're already taking medication for hyperprolactinemia.
Right.
You can make sure it won't interact with your other treatments.
Great advice. Well, I think we've officially covered all the bases when it comes to hyperprolactinemia. From like all those medical details to the lifestyle factors, it's been a really incredibly informative deep dive.
It really has. And I think the biggest takeaway is that prolactin isn't just about milk production. It plays such a complex and multifaceted role in our overall health and well-being.
Absolutely. And while we've learned that, prolactinomas and other medical conditions can really disrupt that prolactin balance, it's also empowering to know that we have some control over our hormonal health through those simple lifestyle changes.
Exactly. Managing stress, prioritizing sleep, getting regular exercise,
Hmm.
nourishing our bodies with a balanced diet, all those things contribute to that happy hormonal harmony.
Well said. And of course, if anyone out there suspects that they might have hyperprolactinemia, the best advice is always to reach out to their doctor.
Absolutely. They can help to determine the best course of action, whether that's medication, surgery, lifestyle modifications, or a combination of approaches.
And remember, knowledge is power. The more we understand about how our bodies work and the factors that influence our health, the better equipped we are to take charge of our own well-being.
Couldn't agree more. It's been a pleasure joining you on this deep dive into the fascinating world of prolactin.
Thank you so much for sharing your expertise. And to everyone listening, thanks for joining us on the deep dive. We'll be back soon with another deep dive into a topic you're curious about. Until then, stay curious, stay informed, and keep those brains buzzing.